Today's class, I taught my students about the STEMI and NSTEMI, and I thought it might be nice if we do a little something for our HCC coders and also for our coders that follow us on YouTube. Your teacher may have taught this to you already. She may have done it differently, but I'm doing this in the way in which I understand it. And also, as always, I encourage you to do your own research and also to check guidelines in the ICD-10 manual. So, as I mentioned, we're talking about STEMI and NSTEMI. You may have seen this term, which is STEMI, and you may have also seen this term, the NSTEMI. And what's the difference between the two? It's actually definitions provided in the ICD-10 manual, but for this portion, what I like to do is draw like a little artery here. And for the STEMI, what we typically see is a complete blockage of that STEMI, okay? This is a complete blockage right here. NSTEMIs are also blockages, but they tend not to be complete, okay? Like it's not 100%, while your STEMIs typically are 100% blockage. So here's the STEMI and here's your NSTEMI. But what do we mean with the ST? What does that mean? We have that in both words. Now, I am not a clinical person. Let me repeat that. I'm not clinical, so don't come for me. This is just to explain something we have to code. But often there's something called a Q wave and maybe an R wave and like an ST wave, okay? And these waves, W-A-V-E, I'm a Southerner, you may not understand what I'm saying, so it's a wave. This wave is something that would be seen perhaps on the EKG or something that monitors the heart. So if there is elevation at the ST wave, a physician would indicate that. And so when you say STEMI, STEMI means ST, this particular wave, ST elevation myocardial infarction, ST elevation myocardial infarction. And the NSTEMI is just non-ST elevation myocardial infarction. So let's recap. A STEMI is typically 100% blockage of an artery. An NSTEMI is not. And the ST is coming from a wave that you can find on, for example, an EKG strip. So let's pause because now we're going to discuss what does this have to do with coding. So here in this document, I just want to remind you to read the entire guideline for coding STEMIs and NSTEMIs in your ICD-10 manual. This particular guideline is section 1C9E1. Again, section 1C9E1. And if you're using an AAPC ICD-10 manual, I believe this is on G17. I may be wrong, but I believe it's G17. So I'm considering this my coder tip for the week. The other thing is the guideline that I'm sharing for you with you. You need to read the entire thing in your guideline because I'm only focusing on a portion of that guideline. So here's an image. I want to give credit where it's due. This is from hopkinsmedicine.org. Thank you for posting this image. But in order to discuss coding for myocardial infarctions, we need to know a little bit more about the coronary arteries. So you can see that the coronary artery It wraps around the entire heart. And on this right side, you have the right coronary artery, right marginal. On this side, we have the left coronary artery, the circumflex, left marginal artery, left anterior descending. And for those of us who do CPT, sometimes you have modifiers that you can use for the heart, and you'll see that these connect to those modifiers. But since I'm discussing ICD-10, let's just say, please make sure you understand the coronary artery, how important it is, because it wraps around the heart, it feeds and it nourishes our heart. So when there is a heart attack, we are able to code whether that was, for example, the left circumflex or if it's the right coronary artery. So again, just a reminder to read your guidelines. Here is a portion of that guideline. So let me highlight it so it stands out. It says if a type 1 STEMI converts to NSTEMI due to thrombolytic therapy, it is still coded as STEMI. So again, what does that guideline really mean? Well, we have a STEMI here that is 100% blocked. This STEMI converted to an NSTEMI due to some therapy that the patient received. Well, even though it converted to an NSTEMI, we still need to code it as a STEMI per the guideline. So this is the reason why it's important to know that the STEMI is 100%. And this one, although it's a blockage, doesn't necessarily have to be a 100% blockage. And also the guidelines, the definition we're going to read in a moment explains to us that the STEMI is worse than the NSTEMI. So before we go over our question from AAPC, let's take a moment to look at something in the tabular of our coding manual. So bear with me just a moment.
Recording in progress.
Okay, so now we are in the tabular section, and you can see that I came to I-21. And by the way, this is an online AAPC publication that I purchased. So it's my book, electronic book, basically. And you can see I-21 is for the acute myocardial infarction. And notice it's quoting that guideline, that section of the guideline that I told you to review. Here's your definition of a STEMI. And it says here, a STEMI is an ST elevation myocardial infarction with 100% blockage of a coronary artery. A STEMI is more severe than an NSTEMI. So keep in mind what you learned. The STEMI is 100% blocked and is referring to that ST wave and elevation myocardial infarction. Now, there's other information here, but I want to keep this video short. But don't forget to look at your use additional codes for this section. Notice now I-21.0. This is a STEMI, but where is it in the heart? The anterior wall, the left main coronary artery. Again, the left anterior descending artery. So if you recall, we took a look at the left main coronary artery. We took a look at the left descending coronary artery. So when coding these heart attacks, we need to know if it's a STEMI, an NSTEMI, and also where the heart attack took place. And when possible, we can actually code what part of the coronary artery was affected. Now, we see here in this one, we know it was a STEMI, but it may have been an other part of the anterior wall. And then you can see some indications underneath regarding the waves, or not otherwise specified here. You can see that. I-21.1, this is still a STEMI, but this is the inferior wall. And notice that's the right coronary artery or other coronary arteries. Do you see the importance of us really understanding our medical terminology, and myself included? I have to work at it. So now we have the NSTEMI, the non-ST elevation at I-21.4. Notice the definition. An NSTEMI is a non-ST elevation myocardial infarction caused by a severe narrowing of a coronary artery. The artery is not 100% blocked. So there is the difference between your STEMI and your NSTEMI. Okay, so how would we even code this? All right, give me just a moment and we're going to see. So we're back to our question, and remember our guideline. If the STEMI converts to an NSTEMI due to thrombolytic therapy, it is still coded as STEMI. So if it's blocked and it becomes unblocked due to treatment, then we're going to still code it as blocked or as a STEMI. So this question belongs to the AAPC. I'm an approved instructor, and I want to give them the credit for their question, but I did change it by putting my name there. Our patient, Geanetta Agbona, was given thrombolytic therapy for an acute myocardial infarction STEMI of the anterior lateral wall, which converted to a NSTEMI. What ICD-10 code is reported? Well, on this side for C and D, I am seeing I-22. And this would be great to discuss in another video, but typically those I-22s are for subsequent heart attacks, which have happened in 4 weeks to 28 days. So really, when you're looking for the answer, it's going to be between A and B. Now, we know that it's a STEMI that converted, and we know that the patient was given therapy. So even though it ended up being an NSTEMI, according to this guideline, even if a STEMI converts, it's still coded as a STEMI. So we know we need a STEMI code. And we also have the anterior lateral wall of the heart. And we know that was an I-21 section 0.0. And if you look at I-21, just look at that subcategory, I-21.0. Notice what you'll see. I-21.0 is for the anterior wall of the heart, while I-21.2 is for other sites. So if you decided that your answer should be A, great job. And if you did not get this answer, please take a moment, pause this video, look at it in your coding manual, and make it make sense to you. Yes, you can send me questions, but keep in mind that I also work during the day and I teach also. So it may be a moment, but I'll do my best to get back with you. I hope you found this class helpful. Please remember that this information came from the ICD-10-CM 2024 manual. Also remember that this is an AAPC question, and you can always go to their website to purchase practice tests. And this image was from hopkinsmedicine.org, and I really appreciate them having that available. And this coder tip was put together by Geanetta at CGS Medical Billing and Coding. I hope you have a great night. Take care. Bye.